and this is our spinal health orientation. This is what I consider the second most important visit that you can make to our office, or now virtually. So as part of your care, it's really important to understand what chiropractic is, and also to be empowered as a patient. I feel like it's the most important thing is for you to have the information so that you can make the best informed healthcare choice for yourself. It shouldn't be something that as a chiropractor, I should tell you what you need to do. I want to give you the information and you should be able to decide for yourself if this is what you want to do. Now, in terms of care, we're going to go over a few things here on this slideshow, but we're going to go over some things that can help you understand better the philosophy of chiropractic so you know the reasons of why we do what we do and why we're adjusting people and why we choose to adjust you and how that relates to your care plan, sticking with the care plan, getting the best results possible, decreasing your symptoms as fast as possible, and also obtaining a level of wellness that you may not have thought was ever achievable without the use of drugs and surgery. So as we move through this presentation, I want you to be aware that the information here is simple yet complex, and we can extrapolate and we can go off the rails on so many different tangents on different parts of it, but I'm going to try to keep it as concise as possible and just get to the point. So let's see, the first slide we have here. Steve Jobs. Everybody knows who Steve Jobs is. He was the CEO of Apple, and his net worth when he died was $10.5 billion. Now, who would want to trade places with Steve Jobs right now and have that kind of money? You could have $10.5 billion, but you'd have to be 6 feet under the ground. So obviously, nobody wants to trade places with him. And with all that money, he still couldn't buy his health back. So the point is that your health should be your most valuable resource, your most valuable asset. No matter how much money in the world you have, you can never have enough to buy your health back. So according to when people have, here's the thing. If you've ever known anybody who's died of a heart attack, unfortunately, I hope you never know anybody or don't know anybody, but if you have known somebody who's passed from heart disease, heart attack, I mean, one of the things, if you were to go back the day before that happened to them and you were to ask them, how do you feel today? What do you think most people would say? They'd probably say they feel fine. And that's the thing, is that you can't judge your health by how you feel. So you could have all the money in the world, you could have no symptoms, and it could be quite possibly that the next day could be your last. So to make sure that you have a certain level of health, there are some very important things to understand. We look at what is the definition of health. The definition of health is a state of physical, social, and mental well-being, not merely the absence of disease or infirmity. So how do you define physical, mental, and social well-being? Well, it's, no physical stress, obviously. Mental stress is something that a lot of us are going through right now because of the fact that we're living in fear of an invisible enemy that's going to attack us and kill us possibly. So that's crazy amount of mental, emotional stress. And then social well-being. We all feel the ramifications of what it's like to be antisocial. So all these things are a recipe for disaster for our immune systems, but also for our health in general. The fallacy of feeling good. So when you look at the top 3 causes of death right now in the United States, the top 3 are heart disease, cancer, and medical mistakes. According to Johns Hopkins University, there are approximately 250,000 people killed every year because of medical caused mistakes. So it's very scary, but most of these, at least heart disease and cancer, you can have heart disease and cancer and not have any symptoms or any warning signs until it's too late. So you can't just judge your health by how you feel. Crisis care versus true health care, right? Most people live in a paradigm of crisis care. We wait till something breaks down before we go to the doctor. We only address our health once we're sick. And then we always blame the outside factors, like somebody else was sick and they got me sick. Or we believe in the germ theory. If the germ theory were true, then nobody'd be around to believe it. And the germ theory is that germs cause disease. And we just know by logic and by clinical evidence that that's just not true. If germs cause disease, that's like saying that mosquitoes cause stagnant water, or it's like saying that maggots cause roadkill, or it's like saying that rats cause garbage dumps to happen. So all these things, the rats, the mosquitoes, the maggots, they're all opportunistic. Germs are the same. They're opportunistic. They feed on fertile soil. So our bodies are always living with germs, bacteria and viruses all the time. And the reason that we're not all of us are sick or dead is because our immune system is constantly fighting that stuff off. So you have to make sure that your body doesn't become fertile soil for that. And in order to prevent your body from becoming fertile soil for opportunistic germs to proliferate and grow on, you want to make sure that you're as healthy as possible and that all your systems are functioning at 100% or at close to 100%, as close to 100% as possible. And we'll discuss where that comes from. To be really healthy is to go to the doctor for well visits, address your health on a daily basis, what you're putting in your body, what you're doing with movement, exercise, what you're doing with mental attitude, and also what you're doing about your integrity of your nerve system. The first question to understand is, how does your body heal? From the outside in or from the inside out? Here's a great example. The fact that the bone is fractured, the cast doesn't do the healing. The body heals itself from the inside out. And healing is the reproduction of new healthy tissue cells. And the reason that we know this is because there's an intelligence in our body called innate intelligence. Now, innate intelligence runs your body and it runs your life. It's the intelligence that creates balance within your system. You don't have to think about breathing heavy when you're exercising. Your body requires more oxygen, so your body starts to breathe heavier. If your body is too hot, you'll self-regulate and your temperature will try to cool itself down by sweating. Or if you're too cold, you'll try to regulate by increasing your temperature by shivering. So these are just some examples of self-regulation. That's innate intelligence. It's kind of like when you get a cut. You don't have to think about it. It heals. Hopefully it heals. If everything's working right, your body should heal. If you eat a lasagna, you have a big, nice plate of lasagna, your body can break that down and distribute the nutrients into your tissues so that you can assimilate that and absorb it and grow. So it's not, like you're eating human tissue, you're eating lasagna, but you can break it down. So that's innate intelligence that knows how to do that. And that's the same intelligence that when the sperm and the egg came together, knew exactly how to develop the cell structure. And it actually developed your brain and spinal cord first before any of the other structures developed. So that's innate intelligence, inborn intelligence. It's smart. It's not educated. This is the way that the spine looks. If we're looking at the distribution of innate intelligence exists that we've determined, scientists have determined that it exists somewhere in the head, specifically a little closer to the top of the neck and the base of the skull. That's where the brain stem is. That's the reptilian brain, the most primitive form of the brain. The basic root center of life comes from that portion of the brain, the medulla oblongata. And if you look here at the top of the spine, on the bones, that's exactly where that area is. Between the first and second bone is where the medulla oblongata is protected. And then your spinal cord runs down the center of your vertebral column. And then all the nerves come out from the vertebral column, just like the wires in the fuse box here. So the brain is literally like the power source of the power coming into the fuse box. All the organs in your body and all the systems are getting energy from all the individual circuits. And the spine is like the actual circuit board. So when there's too much stress or an overload of stress on your spine or in your body, then it's possible that one of those circuits can trip and then it goes into the off position. Or we'd say a subluxation, where the vertebrae can literally shift and it can cause interference on the nerve system, and that can decrease the amount of flow of energy through that particular circuit. So if we look at this picture also shows that the internal organs are connected to the brain through these yellow and green lines, which are representative of nerves. So everything comes from the spine. All the nerve roots pass through the spine through small, tiny openings, and they go into these vital organs. So if we have a question of vital organ dysfunction, it would make sense to look back at the spine to see if there's any misalignment or any pressure on those nerves. It's very much the same as if you ran your microwave and your hair dryer at the same time, and all of a sudden the TV in the room goes off and the lights go out. You're not going to just go out and buy a new TV or get new light bulbs. You're going to think to yourself, I overloaded the circuit, let me go fix the circuit breaker tripped. And then you go down to the fuse box or the circuit breaker box. And since you're not a certified electrician, how do you know exactly which one it is to correct? Well, you simply look at the alignment, and the one that's switched off is the one that you push back on. And that's as simple as chiropractic is. When you get in a chiropractic adjustment, we look for the one that's literally not in alignment properly, and we adjust it to put it back in alignment, therefore opening up the circuit again. And that allows the body to function normally. So, these are some symptoms. Take a look at these. Neck pain, whiplash, stiffness, shoulder pain, carpal tunnel, headaches, sleep disorders, blood pressure or vasovagal syndrome, thyroid dysfunction, digestive trouble, sinus allergies, visual problems with the eyes, ringing in the ears, dizziness, asthma. What do they all have in common? And text neck. What do they all have in common? They're all part of nerve system dysfunction, even just in the neck region. This is an example of a real live nerve system that's been dissected. You can see all the nerves that come from the head and the neck and the brain. And these are the nerves that come out of the neck and go down the arms. And then you have your spinal cord in the middle, and then these are the nerve bundles that form the sciatic nerve, which goes down the leg. Many people get sciatica and they feel that pain even down or tingling down into their toes. So all those symptoms have in common that they're problems just in the neck. So to define what a subluxation is, it's any bone or vertebrae that's out of alignment that puts pressure on a nerve. You might not even feel a subluxation, but it can be detected by taking specific x-rays. Remember, not just feeling good. Here's a better example of what a subluxation is. Okay, it's like putting a kink in the hose or a big rock in the hose. The flow of life coming through that nerve gets diminished. So whatever that nerve is giving life to is not going to have 100% life or 100% function. Therefore, it can run the risk of suffering and dying. It's kind of like watering the grass. You know, you have a brown patch of grass, and we begin to water it, which is the adjustment. We open up the kink in the hose, we give the grass water, but it doesn't get better right away. It just takes time for it to heal and to recover, but eventually that brown patch of grass should turn green. Okay? And subluxations, my picture here is covering it, but subluxations are caused by physical, chemical, or emotional stress. And right now, Lord knows, we're suffering from all of those. Even people who are working at home, suffering from physical stress from doing work on their laptop, not at their desk, and maybe they're laying in the bed, they're sitting in awkward positions on the couch, just poor posture. So that leads me to the next slide. Subluxations come from the physical stress, the emotional stress. This could be chemical and physical stress. If your kids are lounging around and not doing anything and they're just eating a bunch of garbage, working at the computer with bad posture, or just looking at your phone. If you're looking at your phone too much, you're bending your head down, you're taking the curve out of your neck. How we determine this, we look at x-rays. So x-ray will tell us how bad the subluxation is. So I'll find the subluxation like we did on your exam. Then when we take the x-ray, we can see exactly how bad it is, how much damage. The one on the left shows a beautiful curve in the neck. That's a side view of a neck. And you can see this is the base of the skull right there where the arrow is. And this is the shoulder, the top of the shoulder. You want to have this nice arc in your neck with good spaces between the vertebrae. Okay, that means it's a healthy spine, which indicates that you have a healthy nerve system because there's no interference on that nerve system. When we look at a spine like this is severe degeneration. This is a phase 4 degeneration where there's fusion in these joints. They're not moving. There's so much degeneration and bone growth that this is a person who's in a lot of trouble. So we want to prevent you from ever getting to that spot. That's bad news. Okay, we'll take flexion extension views, all right, to detect the stuck joints. When this person's in extension, we can see based on how the neck is moving, which joints aren't moving right and which ones are. More specifically, it gives us an idea of where we're adjusting. Same thing with flexion. You can even see that right here in this example, this disc space is very narrow, and it's even looking like there's some bone growth that's holding it together here. But the one below it and the one above it look pretty healthy. So that's how we can determine that. And then after you do a certain amount of care, whatever your care plan is, then we can go back and revisit, take new films and see the production, see the results that are produced. I can't even talk, but see the results that are produced by comparing it to the ones that you had before. All right, exactly like this. So this person, you can see wherever the red arrows were, these were the subluxations, and you can see the blue C is for corrected. So this is before. They had 6 subluxations in their neck. This is after. They did, let's see, about 90 days worth of care. They did after, and they only had 1 subluxation left that needed to be reduced here. So they got increased mobility, not necessarily curvature correction at this point yet, but that's what can take some time. Curvature correction can take time. It's like putting braces on teeth. But we see range of motion is much better, and the joints, when they're moving better, that means that the nerves are functioning better, and that person is less symptomatic and they function. Here, you can even see this is a reversed curve right here. This patient had a curve going the opposite direction. And then after about a year of chiropractic care, you could see how her curve started coming back to normal. It was getting so much better in the right direction. So results take time. So the 2 phases, corrective care, that's when you're going to get your adjustments, usually approximately 3 times a week for corrective care. Depending on how long you have to do that, depends on your situation. But corrective care, do your corrective care, do your home care exercises. And if you're successful at doing your home care and coming in for your adjustments on time as scheduled, you'll get the best results. So that way you can move into wellness care. You want to make sure you don't abandon the changes that you got, and you want to make sure that you're continuing to get better, but you don't have to come at the frequency that you've come during corrective care. That's the whole point. Nobody wants to spend their life here, but you want to get the work done. That way you can cruise. And then when you're in wellness care, you're keeping yourself healthy. You're being proactive. You're not waiting for problems to happen. Remember, depending on your situation, you didn't get this way overnight. It takes time to have breakdown, especially when you see it on x-ray. By the time you see it on x-ray with a loss of curve or even degeneration in phase 2, when you see those bone changes, that takes time to get there. And that just does not go away overnight. So please be patient. This is why they call you a patient. Okay? Remember, we're not treating the pain and we're not treating the symptoms. If we did that, that's like the house that would be burning. That's exactly like the fire department showing up and then clipping the wire to your alarm and saying, okay, we took care of the problem, Mrs. Jones. There you go. We're all good. It's totally ridiculous. So that's what it would be like if we were only treating pain and symptoms and not correcting the cause of your problem. So we're not focused on the pain and symptoms. Of course, I want you to feel better. And feeling better is important. And it's important to your function. But functioning better is more important, and staying well is even the most important. It's much easier to stay well than it is to get well. So chiropractic care is about correcting your nerve system dysfunction so that your body can take over and heal itself without the use of drugs and surgery. All right? And we know that subluxations in the spine can't be cured with drugs. There's no pill, potion, or lotion that you could take or put on your spine to correct a vertebral subluxation. It needs an adjustment. The problem is that so many people are only treating their symptoms with medicine. And we see here, even according to this article, Americans are taking more prescription drugs than ever. All right, August 3rd, 2017. All right, the survey finds that 55% of Americans are regularly taking at least one prescription drug. All right, so we have to try to change our paradigm, change our thinking, look more towards cause versus treating effects. And when we're talking about immunity and immune system, that is just another system like your cardiovascular system, your respiratory system, your digestive system. All of those systems are controlled by your nervous system. Stress has a huge impact on the function of your nerve system. And chiropractic can help you reduce that stress so that all of those symptoms can function better. You got one spine, so take care of it. I'm going to give you home care as we go. Depends on what's necessary for you and your situation. But your spinal home care is so important. Make sure you do it. You only got one spine, so take care of it. Okay? Posture, huge, huge factor in spinal dysfunction. We got to get your posture better. There's lots of exercises and stretches. I have videos on that. I'll guide you along the way on how to keep your posture better. Okay? You want to get range of motion, strength, stamina, proper nutrition, proper joint lubrication. It's all very important. This is a great slide because it shows the women's national soccer team. It also shows the women's gymnastic team, Arnold Schwarzenegger, and then there's a friend of mine there, Dr. Ryan Zimmerman. He's a chiropractor out in Los Angeles, California. It just shows you that there's pain that people come in for, but there's also performance. And when people get to a certain point in healthcare, when they're staying well and they're functioning well, they maintain a certain level of performance. Optimal performance is achieved through proper nerve supply in your body. And when your nerve system is clear, your body can function so much better. Athletes all around the world, major professional athletes, are all choosing chiropractic care because they know that they function better. And it just so happens that the gymnastics team won gold. The women's soccer team won gold. They won the World Cup in the final. Arnold, he's won so many championships, and he's also a huge proponent of chiropractic. So you think of it as far as performance. You know, when we think about these are professional athletes, but most of you I'd consider corporate athletes because you still have to perform at your job. You have to perform mentally and sometimes physically. And you have people that are relying on you. Your people at home are relying on you. So you want your performance to be optimized. And that's a really, really great reason to continue chiropractic care after you've reached correction. So think about the people around you who are either living with you or who are working with you that might have a subluxation. It's literally like the danger that's hidden below the surface that people don't see. They don't know it's there. They don't feel it. And if they have subluxation and it is causing them to be dysfunctional, or they're not as happy as they want to be, they're not getting the proper sleep they want to get, they're just not feeling good, they're not functioning well, send them in. Tell them about chiropractic. Procrastination is known as the thief of health. So if you wait too long, usually it's never going to happen, right? When they say time kills all deals, if you're in sales and you're making a deal, time kills the deal. People always want to high pressure sales you. That's why high pressure sales actually works, even though nobody likes it. So procrastination is the thief of health. I don't want you to procrastinate with sharing this information with somebody else. This is the way we help people. We're having a storm right now, so there was a temporary power outage, but this is the way we help people. It's through word of mouth. I'll do the best I can for you, and then tell somebody who you love, because you don't want to have people who you love or people even who you like or even who you work with. You don't want them to suffer unnecessarily. All right? So please tell them if you do spread the word and they come in because of your referral, I'll be happy to give them an exam, consultation, any necessary x-rays at no charge. It's just my way of saying thank you and just seeing if we can help, especially in these times right now when we're all locked in our homes. It is safe to come into the chiropractic office. We do have things under control here as far as mitigation with cleaning and disinfecting. Also, we can see people who are essential healthcare workers. If anybody has an emergency where they're feeling pain, let's say on a 10 scale, they're feeling pain of a level of 5 or more, and they really need help, they can come in. It's totally fine and totally okay. Just have them give us a call at the main office, and the number is 631-663-5555. Thanks very much, guys, and I appreciate you watching this, and I look forward to seeing you on your next visit.